Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy.
And my name is Sarah.
And we are your podcast hosts. So just remember, we have our Gritty Nurse apparel line. Go to www.grittynurse.com to subscribe and get yourself some great swag.
And we also want to let all of our listeners know that we have a Patreon account. You can find us on patreon.com/grittynurse. If you're listening on Apple Podcasts, Google, Spotify, Amazon, or any other podcast platform, just be sure to hit subscribe so you can get a notification every time we have a new episode. Also, don't forget to rate and review us.
So, Sarah, what are we hitting people up with today? I mean, it's almost election time. People are getting ready to go and vote, or they have casted their ballots. But I know one of the hot topics always is,
Dun, 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 universal healthcare.
oh my God, why are we going here?
We're not going to get too much into the politics of this one, but we just wanted to talk about universal healthcare. And Amy and I both being Canadian, we thought it might be something of interest to you guys because, it's been something that I feel like has been it's been in US politics since the time of Clinton, and there's been a lot of back and forth. And we just wanted to share our experiences really living in a universal healthcare system since birth, so over 30 years, and kind of what that's been like. And then, share some personal stories about people that we know who have been in the States who have had to really pay an arm and a leg just to get basic healthcare for, emergent situations.
Yeah, or what
Um,
we would consider basic health care.
right,
I
right.
think for us, we haven't experienced the healthcare system in the United States, but we've heard lots of different stories in terms of what happened. So, I mean, I'll start to say that I am no expert on the American healthcare system. It seems much more complex than I think it actually needs to be. But I can tell you, I'll be the first to say that I have not gone and done any real extensive research. I think as far as I've gone is David Packman.
Okay, yeah, so just consider this our disclaimer that we're not experts, but we just want to share what we do know. And I guess
Right.
just to back things up a little, just to talk about what universal healthcare actually is, it's a healthcare system in which all residents of a particular country are assured access to healthcare. And it's generally organized around the thought that all residents will be able to access healthcare, not only the ones that can afford it, and it's just really to improve health outcomes of the greater good. And really quickly, the first country that started universal healthcare was actually Germany in 1883, and then it was followed by the United Kingdom, Russia, Japan, New Zealand, Australia, and then World War II hit. A lot more countries got on board afterwards. So we had Sweden, Iceland, Norway, Denmark, and Finland. And I was actually really surprised to learn that Canada didn't start universal healthcare until 1962 with the province of
Yeah. Wow.
Saskatchewan. I know, I was really surprised. And then followed by the rest of Canada between 1968 to 1972, which was way later than I thought. I don't know why in
Mm.
my mind, I'm not really that into history. I thought for some reason that we always had universal healthcare, which is really silly. I don't know why I thought that, but there you have it.
Well, I mean, that just goes to show, right? Like, I mean, us millennials, we're so I don't know what the right word would be, but like I think we sometimes assume that this is how it's always been. And of course, things change over time. But I mean, I didn't know that. So history lesson to me as well, to say like it wasn't something we've always had. And I think the one thing about change and looking at different plans is understanding that change doesn't necessarily have to be a bad thing. So
Right.
I know out there, it it's very scary. We actually did a little bit of a poll. I think I took a screenshot, so let me maybe just pull that up here. I did. So I asked a question to our Instagram followers. All right, is universal healthcare a scary thing? So I probably should have been more specific, but I wasn't. And it was just a yes or no. So 44% said yes, and 56% said no. So I think even right there, it's kind of like, whoa. I think there just has to be much more conversations had about what does universal healthcare look like in the States, and what all we can do is tell you what it kind of looks like here. So maybe the first thing I'd start with is healthcare in Ontario. So we have something called OHIP, and OHIP is Ontario's healthcare plan. So through OHIP, the province, so we have various different provinces. So like, oh my god, I'm drawing a blank.
Okay, you
We
don't have to
have.
name all of them. There's
I'm
like
not going to name all the provinces, but it's just like how you guys have states. So we have several different provinces, and each province pays for many of the healthcare services that you need. And obviously, it's through taxpayers' dollars, but it covers a wealth of things. So OHIP covers appointments with your family doctor, visits to walk-in clinics and some other healthcare providers, any specialty types of appointments. So, like if you have to see a specialist and you're referred, any visits to the emergency department, various tests and surgeries. There's certain things that it doesn't cover. So sometimes it doesn't cover eye exams or dental, but I actually did some digging that there are certain people who are exempt from paying eye exams and certain things. So like and we have different plans for people who have like disabilities and whatnot. So I mean,
Yeah,
for
and
the
I think
most, yeah,
I
go
think the
ahead.
way that you can think of it is any service that's provided to you by a hospital pretty much is covered by OHIP. So whether it's an outpatient appointment, an inpatient appointment, a surgery, any sort of appointments, like you said, Amy, like in a clinic or a doctor's office, that's all covered. And I believe for optometrists, if you are diabetic or you've got some high risk health conditions, it'll be covered. And then for the most part, dental care is not covered. But I think if you're under 18 or something like that, if you needed some sort of emergency service, it might be covered. But the other
Right,
thing that
right,
isn't covered that a lot of people maybe don't realize is prescription drugs, unless,
right.
well, I think if you're a senior, maybe it somehow gets covered, but mainly it doesn't get covered.
Yeah, like, and I think that that swings depending on who's in power, right? Like, I think there was like that plan previous to Doug Ford coming in. I think it was Kathleen Wynne, where all seniors and teens, or
Oh, yeah,
sorry,
yeah, yeah.
persons under 18 were all covered. And obviously, that was a very expensive plan. So, obviously, from a fiscal standpoint, that's a lot of money that's being spent to offset those costs. But I mean, when I think about it, I don't know if it made a huge difference for me because I wasn't necessarily consuming any um, particular types of drugs. And I mean, we don't have things like co-pays and all those different aspects. So, for example, if I needed a prescription drug and there's actually a lot of drugs that are covered under OHIP. So, let's say I needed, I don't know, blood pressure medication or whatever. I would go, I'd get the prescription from my doctor, or they'd fax it to Walmart pharmacy or whatever. And I think the most I would pay is the like Walmart dispensing fee of $2. And actually, I'm so ghetto. Like I like shopped around to make sure that I like could find the cheapest dispensing fee, and I actually got it down to the fact that now I don't pay a dispensing fee. So
Are
it's
you
kind of like,
serious?
yeah,
I
I'm
have
so
actually heard that
steamy.
The Costco pharmacy is really cheap. That's where my parents go to get their medication. So,
Oh, okay. No, I haven't.
because yeah.
Actually haven't tried that. Knowing how often I'm at
Well, I
Costco, I
mean, you
totally
and I
should.
love Costco so much. I feel like this should be part of the conversation. Costco pharmacy, everyone.
Oh no.
No, but
So
we're not like promoting them in any way.
we're
I'm
not
just
endorsing
saying.
anything. No, no.
Yeah.
That's it's just because we spend way too much time and money there. But yeah, like I mean, in terms of prescription drugs, I'd say quite a bit are covered. And yes, so you'll pay a very small portion.
Mhm.
Um, some other things that aren't covered. What else is not covered? So we talked about dental. So like cosmetic surgery, that's not covered.
Yeah. I mean, things like massage therapy or going to a chiropractor or going to a naturopath, I actually made a list. And then even just stuff like going to counseling, psychotherapy, couples therapy, none of that is covered. So there are a
Right.
lot of sort of allied health services that are not covered by our plan. And so you would have to pay this out of pocket, or if you have, a job that provides you benefits, often that company would pay for these services either all or partially. So it really depends on where you work. And I think there's some inequality in that as well, because obviously if you're not working or you don't have a job that provides you these benefits, then you're either paying out of pocket or you're choosing not to use these services because you can't afford them.
Or even if we kind of extend that further, you can think about so like for example our emergency departments, maybe those won't be used the way that we would intend them to be used, because for example maybe that patient who has a history of mental health issues or illness will more likely to be seeking out visits to the emergency department in crisis versus seeing a primary care physician, or actually having access to a one-on-one counselor. Yes, we have lots of different, and that's the other part that's actually really good about OHIP. So um, we actually have others like outpatient services that they might not have to be billed for there, and those types of services are also covered under the Ontario Health Plan. But back to kind of what I was saying is, like you said, there still are some disparities there where, for example, we might see that misuse of the emergency department where because they can't access those services due to lack of employment.
And I guess my only experience with how much stuff actually costs is when I did work at the hospital. Sometimes we'd get patients from out of country and they're
Hmm.
not refugees. So in Canada, if someone is a refugee, we do cover their healthcare. But if someone is just, let's say, they've been traveling and they didn't buy health insurance and now they need care, we actually could see what the real cost of the care was. So,
Right.
for example, right, like when I used to work in the women's gynecology clinic, an outpatient appointment would be $500 and they would have to go down to the hospital cashier and pay that. So, just to see a doctor for an initial consult, it was $500, and that was 10 years ago. And I think that
Yeah.
even for hospital stays, right, we often had a lot of birth tourism. So, people that would come to have their baby because they wanted their baby to have a Canadian passport. And we'd be charging them, I think, something like $1,500 a day just for basic care. And so that sort of got me thinking about like what the true cost is, but we just don't see that because we pay it through our taxes.
Right, right. And I think even just kind of thinking about that, I think talking about the premiums, I think one of the things that people are really concerned about is with universal healthcare, there are high costs in terms of how much we're paying out of pocket for it. And I think I read something and it's really dependent on your income, right? So I think there's actually like a max. So like the minimum amount of pay that someone might pay if, let's say, they're from like a lower socioeconomic background or they have a very low income. I think it says something like it works out to being like $60 a year. So that's like really not very much. And then if you're looking at people who are making 200K plus, I think they're saying it's up to like $900 for the year. So I mean, I don't think we really miss that money in terms of what we end up kind of receiving in services. And this is the whole I'm going to pull up my whole my lean sigma 6 training, where it's like what are you willing to pay for? So I think for me, like I'm willing to, I'm not going to disclose my income, but like I'm willing to say, hey, I would rather pay for this or pay into the system versus pay when I need care, essentially, right? And I think the other part that I'd like to talk about in terms of our system here, in terms of universal healthcare, is regardless of your status, your income, employment, health, or age, you get care. Like, I mean, like there's no specific physician that you have to see or that you can or can't see. Um, there's no specific hospital that you can and can't go to. If you're sick, you go to the hospital and you receive treatment. If you're rich, you go to the hospital and you receive treatment. If you're poor, you go to the hospital and you receive treatment. Like I hope you're kind of getting what I'm kind of trying to say, because I think there is that huge disparity. Not saying that we don't have health disparities here. Of course we do. Like I think the other thing that I want people to realize is our system is not perfect. And I don't think there is any perfect system out there. But we don't we don't have to worry. Like, I never had to think about for 1 second that if I was going into the hospital, I have to be concerned about whether I'd be able to pay for my visit after I left.
Well, I think the only thing that you would pay for, and this is totally optional, is if you're in a hospital and you don't want to be in a ward room, meaning you don't want to share a room with four people, like you don't want to have four people in your room with a shared bathroom, then you might opt to upgrade your coverage, right? So that you could upgrade to a semi-private, meaning that you've got one roommate, or even a private room. So I think that that would be your total cost if you even wanted to. Or let's say you wanted to get Wi-Fi or you wanted to get TV channels, then you would pay extra for that. But it really has nothing to do with the actual care that you're going to receive. It's just,
Right, right, right.
I guess another thing would be if someone was coming to visit you, they'd have to pay for parking. But like, it's nothing that you have to pay out of pocket that would prevent you from getting life-saving care that you would need.
Right. Like, I can kind of give an example of myself. So for example, when I was, I guess, oh my gosh, how many years ago would this have been? Maybe, so this would have been maybe 5 or 6 years ago. I had found it that I was pregnant, but then I was just like walking around the house and I had like ridiculous pain, kind of fell down, had to pay, so we do pay for ambulance, so EMS. So I had to have an ambulance pick me up, take me to the hospital, and then I found out that I had an ectopic pregnancy. So that same day, I needed treatment and had to have surgery. Um, I didn't. They picked me up. They took me to the closest hospital that was available. I didn't even think I had my OHIP card. They just looked in the system and was like, "Oh, you're Canadian. You get care." And I was like, "Yay!" They wheeled me up. I did the surgery. They gave me a prescription. I went home, and that was the end of it. Right? Like, I didn't have to worry about, oh my god, like I'm gonna need to set up a GoFundMe account to now pay for this emergency surgery that I had to have, or
I know. Yeah.
I'm, maybe I can't afford the medication that I have to take to to prevent this from happening, or well, I guess it's not to prevent this from happening, but there was a medication that they gave me called methotrexate previous to my visits to say, hey, let's see if we can kind of, stop the ovum from growing. Like, I mean, I didn't have to worry about whether I would be able to afford this type of care. And I think for me, that's the scariest part, where I guess countries who don't have this single payer healthcare system, how is their health actually dealt with? And I feel that that's where we see some of the liability and risk. And I know that there is liability and risk in our system too, but we'll kind of circle around to that. But I think we're still talking about the pros. So
Yeah, and I think also people might be wondering about things like wait times, right? So in Ontario, there's publicly available information about what wait times are for what types of surgery and the certain benchmarks that hospitals have to meet. So for example, I think for knee surgery, let's say, you have to be able to get the surgery within X number of weeks.
right.
And if you don't, then the hospital actually gets penalized, meaning they could lose some funding towards their services. So there's a real incentive to make sure everyone gets, they get their surgery done on time. But the other thing I wanted to say is that I often got patients from other countries who didn't realize that there really is no way to bump the line. And they'd be trying to bribe us with like money, like, okay, if I give
Yeah.
you $5,000, can you move me up? Can you do this? And we're like, no, we actually don't have the power to do that. And you bribing us actually makes us feel really uncomfortable. So there's nothing you can do.
So yeah, like, I would agree with, I don't think we can dispute the fact that wait times is considered a con to our system. And I can see people saying, hey, you have to wait for a surgery. Let's say you need a hip surgery or something, and you, during the time, the 6 month wait or whatever that you have, your condition can continue to deteriorate. Yeah, that's true. But that's why we also have primary health care, right? So the other part of that is, with our model, we have something called like education programs and also primary health. So primary health is actually, you know, during the time that you're waiting or whatever the case may be, you're followed up by your family practitioner. And if something changes, you can always go to the emergency department. So if it ever got to a situation in which you're more urgent than the person who's in queue, that like you're going to get the surgery. They're not going to wait till you're like dying on the street to give you the surgery. It's just like you. And then there's educational. So we promote something called, I guess it would be, it's not just called primary healthcare. I guess it is the primary healthcare model, but preventative medicine. So we want people to, we talk about like health promotion and how to keep yourself healthy and various different things that you could do. So we start kind of like at school age with just some of these smaller interventions that people can manage on their own, and really teaching people when to visit their primary care provider as opposed to like waiting till, a situation's really bad. But I think even though we have those weights, those other services help in terms of, um, trying to prevent some of these things from happening. So yeah, like I mean, I've been to the ED where, sorry, emergency department, where let's say I needed some form of a treatment and I had to wait for 4 to 5 hours. But the other thing is, I'm sure that they use the same systems that we do. So something called EC tasks, where a patient who walks into the emergency department is triaged based on the severity of their illness. So it's not like a first come, first serve basis. It's based on how acutely ill the patient actually is. So, I mean, you walk in, if you're dying, they're going to take you right away, right? I mean, sorry,
Hmm.
that sounds really bad, but like I mean, obviously if you're like, if I come in and my situation's non-urgent, I'm going to wait longer than someone's situation who is urgent. And I think that's, I'm willing to do that.
Yeah,
I think
and
that's fair.
I think the other thing is I'm actually really baffled by the rates that Americans pay for their health insurance because I mean, like I met people when I was traveling, like a couple that was in their 20s, perfectly healthy, no health conditions, and they told me they paid $500 a month for health insurance. And it's for them
Right.
to cover like just the basic things. And I just totally baffled my mind. And then I met someone else who said, I think she said she had one abnormal pap smear once, and they
Right.
considered that a pre existing health condition. And they added money to what she had to pay every month for
Like
health
her copay
insurance,
or
her
whatever. Yeah.
copay. And then
Yikes.
I think she had like mild asthma, which is nothing, but I guess to them it was something. So, I mean, I find that really interesting too because I don't know about you, Amy, but I don't pay anywhere near $500 a month for my supplemental health insurance through where I work.
No, and I mean, like, I mean, if I think about my paycheck and kind of what comes off, I think what people are really scared about in terms of the term universal healthcare is the fact that their premiums are going to go up. Um, I think with any new system or trialing of anything, that's something that tends to happen. So when I think about like change management in terms of practice, so oh my god, I'm getting into my nursing stuff, but for example, let's say we have a new initiative. Oh my god, give me something. Let's say we have a new initiative on changing the surgical safety checklist in the hospital or whatever, right? And we weren't using that process before, and now we're implementing this new change. Well, initially, that new change is going to seem like it takes much longer because people have to get used to the process. There might be there might be new steps that need to be taken. People just are resistant to change. So initially, it seems like that new change, that new thing that's coming in, is going to be more cumbersome. But as you get used to it, it becomes a well-oiled machine. You do your PDSA, so you do your plan, do, study, act, you tweak, you tweak until you get something that works well for the team, that works well for everyone who's participating. And that would be the same if they implemented a plan related, or any plan related to universal healthcare. Like I think, yeah, maybe initially that cost would go up. Like I don't know, but I think that as you tweak things and you change things and you make it work for your system, that you can make it efficient and make it work for everybody. Like I think I just see so many positives to having this type of a system, um, that I don't see where you can go wrong.
Yeah, and I'm really proud to be in a country where we have universal healthcare, despite the fact that it's not perfect. And yes, there are things like wait times, and yes, we do pay higher taxes. But I would rather have the peace of mind knowing that if I were to get sick, that I don't have to remortgage my home or go into debt. I mean, being sick is stressful enough as it is without having this extra layer of worrying about paying for every little thing that you need. And I think some people would forego things, right? Because they can't afford it, to be honest. And that just really makes your long-term health suffer in the end. Did you want to maybe share a personal story about the healthcare system, or
Um,
you want me to share my
yeah.
story?
Sure. Well, I wanted to touch on kind of one point now that I just remembered.
Okay,
So one of the other things that I guess that we don't have to worry about so much is like veterans are actually looked after very well in their elder years, right? So in terms of our history, the government doesn't just treat injuries sustained by the government just doesn't treat injuries sustained in service of their country. The veterans get whatever care that they need. So it's like whatever they've provided a service to us, we will fully take care of them. So there's, and whether it's disability, whether it's mental illness, whether it's just chronic illness, we take care of our veterans. We have community spaces and beds specific to veterans. Isn't Sunnybrook has a whole like wing dedicated to veterans, I think.
possibly.
Uh yeah, so like I mean, I think that one of the things that I think is really important is they really take care of their veterans. So like for example, my grandfather, he fought in the World War II, and even when he was sick, like it's kind of amazing, like the Royal Legion reached out to us for support. um Organizations were really helpful, like he got everything that he needed. And even when he became palliative, it was just the overwhelming support that we received from like the various different veteran groups that he was affiliated with was amazing. So I mean, he's now even buried in a veterans specific cemetery, and I think it's just it just goes to show that we value I guess our elderly and our veterans differently. So
I didn't realize that part about the burial, that he was in a special area.
yeah, so he's buried in Mississauga, and they actually have a specific veteran section. So there's actually a whole section that were for the people, the Vietnam vets, as well as people who fought World War II in the Royal Air Force. So my grandfather was in the Royal Air Force. Um, I don't think he flew planes, but I know he did some stuff with bombs and whatnot, and he did some like covert type of operations, and it was kind of really cool. But yeah, unfortunately, he's not here. We still have some of his memories, so that's always a really good aspect. But yeah, he got really great care. Um,
That's
another
amazing.
thing,
I actually
another
didn't know that much about veteran care.
yeah, oh my gosh, they get like it's actually really great. Another point before we get into our stories is and maybe you can touch on this too. So, yes, we have universal healthcare. People who are regionally based. So, let's say they're based in epicenters or, city centers, I should say, or more urban areas. Yes, they have greater access to care. I think that's just a given, right? So, in terms of a con, people who are in rural areas. Oh my god, I can't say that. Rural. Can you say it, Sarah?
Rural areas. Okay,
Yes.
this just there was this episode of 30 Rock. Sorry, just to digress a bit.
It's all good.
Where there's like this the rural juror, and this was like a show that one of the characters was on, and nobody could say it. They're like the rural juror. So this is like
Okay.
a sing rural.
Okay. So essentially, healthcare coverage and healthcare revenue are redistributed kind of according to demographics, right? So obviously, places that are highly populated and more populated dense get more funding. And I think that's how it goes probably in the US as well, right? So access to care is not as equitable as it could be. Do we have other ways and means of trying to reach and support people who live in rural communities? Yes. So there's like virtual care options. I believe I've read stories of people being flown out for care if they're in such far areas. Um, but I know we do try to support these people who live um, further from these centers to make sure that they get the care and the access of care that they need.
Hmm.
However, I do know that it is a gap within our system that needs more recognition and more support. So, and I think it's just also just talking about like resources too, right? Like physician support out there. Maybe there's more NPs, which is fine as well because they're also a part of the primary healthcare model. Um, but just, you know, their access is limited, so definitely a gap in an area that we need to look at. But again, like I said, we have excellent primary care here, um, and I think we just have a better handle on chronic illnesses. But
Yeah, yeah.
I digress.
Yeah. So I just wanted to actually share kind of a story, like my experience of someone I know who is Canadian, but went to the States and ended up needing healthcare and ended up paying an arm and a leg. So my uncle in law used to have a business where he kind of worked and lived in the States half the time. And so this was around, I would say, like the early 2000s. He was in Detroit, I think, and he started having really severe chest pain. So he was trying to drive back across the border, but he couldn't make it because he was just in too much pain and he was by himself and he was driving. So he ended up going to a hospital in Detroit. I don't know which one it is. And told them that he had chest pain. And then he has a family history of heart attacks. So I believe his father had a heart attack and passed away in his 40s, like really young. So of course they're like treating him as though he's having a heart attack. Like they gave him the clot busting medications. They did
Right,
like
right,
all
right.
kinds of monitoring. I think he stayed overnight. And then it turned out in the end, he had a gallbladder attack. So it wasn't his heart at all. Do you want to hazard a guess as to what his hospital bill was?
Okay, I am going to guess it was nothing less than 20,000.
It was close to $40,000.
Oh,
And this
no.
was like 15 years ago.
Well, no wonder people have to like do GoFundMe pages. Like I'm pretty sure that GoFundMe was created by people in the States who are like, we can't afford this shit. Like we people out there are losing their homes, they're losing everything to pay for care. Like I think that is just for me, it's just like super mind-boggling. That is just like I wouldn't want to rely on the kindness and generosity of others to see whether they would or would not pay to help support me during my time of illness. Like you're already so vulnerable. Like now you're going to add on like economic and financial crisis and stress to the fact that you just had an overwhelming illness. Like I think to me it just sounds like a recipe for more issues with care, right? Now you're adding mental health stress onto it. It's just it sounds like a
Well,
nightmare.
it's like really, it's like, do I want to pay my mortgage? Do I want to be able to put food on the table? Or do I want to get medication that I need to stay healthy? It's just not fair that you have to make these decisions. And I guess, like, just going back to my uncle in law, he tried so hard to get across the border. And he's like, if I had
Oh,
been able to do it, I would have done it.
no.
Like, honestly, I think he said he was half an hour away and he just couldn't do
Oh,
it. And I feel for him because I don't know how he settled his bill in the end. Like, I don't know if they require a lump sum payment or if they take installments or how that worked. But I mean, like, he did obviously pay it, but it really, really put a dent in his pocket. And
yikes.
I mean, like, okay, so just going to the flip side, let's say he had made it across the border and he got to a hospital in Windsor. His bill would have been $0. Zero.
Yay.
Yay. Zero versus $40,000. And I believe
Oh
it would have been the
no.
same level of care. I really don't think there would have been a difference, like, not a significant difference.
Well, this is where I guess you kind of think to yourself, right? You're like kind of like, well, again, I don't know, like is it the idea that and I'm just asking because I generally don't know. Is it the idea that, well, if I'm not consuming services, I don't want to pay for services, or the idea that,
I
I don't
think
want
it's
the
more
government to
like,
interfere with
yeah.
my money and like whatever I make is mine, and I don't think I should have to pay into this big system so anybody else can receive care. Like I don't really know what is the thought behind or the fear really surrounding universal health care. So to me this is all I know, right? Like you, this is all we know. So when we hear these stories, it's so surprising to us. So I'll jump in and kind of tell you the story about my brother. So my brother and his wife live across the street, literally like across the street from a hotel. and my brother has Crohn's disease, and he has it pretty severely. So whenever he has an attack and he needs to receive care, he doesn't actually have, I guess, specific insurance for the hospital that's directly in front of his home. So he has to drive 20 minutes down the road to go to a different hospital, because that hospital will actually cover some, not all, some of the costs of the treatment that he may need. And I was just like, I remember talking to him, and I was like, he was telling me how much pain he was in. And he's like, oh, I'm in the car. I'm like, what do you mean you're in the car? Like, the hospital's across the street. He's like, no, I can't go there. I'm like, what? What do you mean you can't go there? And he's like, I can't. Like, I don't have coverage for that hospital. And I was just like, that's where you see the huge disparity, right? For me,
But
that's
I think in America that is so common, right? That we think that's crazy, but it actually isn't, because that is how people have to think about where they go all the time. Like for us, the ambulance literally will drive you to the closest hospital. That is their protocol. But in the States, it's like, okay, what's your like what system are you part of? Like, okay, so these hospitals are in your system. We will go to one of those. It doesn't matter if it's like half an hour away.
this is what would be concerning to me. I want to be able to go to a place where I know they're going to treat me and give me the same care that they would give, I don't know, Beyonce Knowles, right? Like, I want to get the same care as someone who, like, I don't think I should have to worry about, if I go into this hospital, I might not be getting the tests or the services, or the care provided as necessary, because there are hospitals who have better coverage, so they might be able to do better tests or better screening.
Right,
Like,
right.
I think for me that is super concerning, because I want when I walk into a hospital, I want to ensure that I'm going to get the best of the best of the best. So I know that here in Canada or Ontario, wherever I go, whatever hospital I land in, I know that if they don't even have the adequate care, they can send me to a higher level center, and I'm not paying anything extra to see this person. So, for example, when I was pregnant with my twins and I became high risk, and they had to transfer my care from one high risk specialist to another, even more high risk specialist, that it didn't come out of my pocket. Like, it wasn't an extra expense, or I didn't have to worry about saying, "Oh man, like I can't actually afford to see this specialist in preeclampsia because I can't afford it, or it's not a part of my plan." Like,
Yeah,
it's
yeah.
not something that I ever had to come across my mind, right?
Yeah,
And then the
just going
follow-up care is exceptional. So, like,
mhm.
even afterwards of having preeclampsia and staying in this, I guess it would have been like a tertiary care center. So I think in the States it's flipped. Like, I think their level ones like are level 3, but it's just like I still get like, now I see a cardiologist. I saw an internal medicine specialist. I saw and all of these extra people and extra care that they did follow up. It was all under OHIP.
Right. And I think just going back to your comment about Beyonce and like the average person receiving the same level of care, I used to work in a hospital where we had a lot of high profile celebrity patients come through. And I can honestly say that they did get the same level of care.
Yeah,
Like we might have given them a slightly bigger room that was a little bit quieter, but that's probably the extent of the difference in care that they received.
yeah.
It's really just everybody is the same. And I think it's hard for people to wrap their minds around that because it doesn't work that way in a lot of other countries. But here it really is. Like, let's say Justin Trudeau, our prime minister, got sick one day and he ended up at the hospital. He would still get the same level of care as anybody else. They might have to like make sure that, you know, things are just that people aren't snooping, I guess.
It's more
Like
about the
media,
privacy
it's
aspect. So,
yeah,
for
it's more
example,
the
he's not gonna go to a
privacy.
specific hospital that looks like a hotel. He's gonna end up going to the Ottawa hospital or whatever the case may be. Like, anybody might end up there. Like, we don't have special hospitals for special people. And it actually, it kind of this just reminds me of this one particular nurse, and I'm sure you can actually remember who this is, where it was actually one night when I was working in labor and delivery, and this physician came on, and I guess he thought he was hot shit, and he's like, "I'm a doctor.
Oh,
I
yes, yes.
deserve this care." And the nurse just looked at him and was like, "You are going to get the same care as everybody else. You need to sit down." I was like, "Mm-mm." I was like, that is the best. And it's true though, right? Like, I mean, you're not going to get fast tracked because you have extra credentials or you're a big name whatever in the world. Like, I think of course we'll do what we can to accommodate and flex or whatever, but we are always going to look at the patient as the center of the situation. So does that person need more care than the person who's in front of you, behind you, whatever? We're going to deal with the person first rather than the expense and the flash and the glam of being a celebrity second. Like, I'm not saying that they don't get special perks, but I'm saying that they don't necessarily jump the queue.
Yeah, exactly.
And definitely that nurse that night showed that she did that person was not going to jump the queue.
I actually could think of a few nurses who would say that, but I know kind of who you're talking about.
Yeah, she's awesome. Oh my goodness.
So was there more about your brother's story, or was it just that he lives across the street from a hospital?
Yeah, so it was that, so that was the one part, and then there's the other part. So he is Canadian, and I guess he's a Canadian citizen. So I guess his dual citizenship. He's
Yeah,
Canadian
yeah.
and has American. His green card. I don't know what it is. Anyways, um, there was a treatment he needed called Remicade. His coverage didn't cover it. I know. I think this sounds schemy. As he would just come across the border and get his treatment.
But that's okay, right? Because he is a Canadian citizen, so I don't
Yep, he
see.
still has his OHIP, so he just rolled. He literally like rolled across the street and like got his IV infusion and would just go back home.
So, did he ever say how much it would cost if he had it done in the
I think
States?
he was saying, you know what? Don't quote me, but I think he was saying it was
Mhm.
upwards between like 4 to 6 grand or something,
Per
something stupid
treatment?
like that. Yeah,
Wow.
or that, or his plan didn't cover it at all.
Oh my gosh.
So yeah. I mean, that it's like thinking about the whole thing about like insulin, right? Like for us insulin, I don't want to say insulin's like candy, but I mean like for us it's not even like it's not a second thought. It's just like a patient needs insulin. It's affordable. We give them their insulin. And it's just the whole like it's so expensive out there. It's because with privatized medicine, I guess comes with the fact that um there's that weird, I guess, competition, right? So you can now there's big pharma involved. There's money involved. So it's kind of like a popularity thing, right? So you can pay more for this, or I don't know. It's just it's we don't have that problem here.
No, and I think big pharma is so ingrained into the US healthcare system that I don't know how it would be changed. Like here, I don't know if you noticed recently, but the pharmacies here now have like brand name medication and also generic medications, right? So you can
Right, right,
choose the
right.
generic medication and pay substantially less if you don't have coverage for medications. And a lot of people will do that because it is a lot cheaper. But some people if they have coverage, they'll be like, "No, I want the brand name because I feel like it might be better for me or whatever." So, it's
Right.
your choice what you can afford, but there is that option too.
Right. And I think just for those who might be listening who might not know the difference between brand and a generic form. So essentially is really so Tylenol would be considered the brand, but then acetaminophen is actually the generic name of the drug. So the contents of the two medications are exactly the same, but one is branded. So I
Well,
mean,
it's
I
just
think
like it's
it's
just
kind of
like
like in your
buying
head,
it's
right?
like buying clothes, right? It's like, do you want to get something that's Calvin Klein, or do you want to get something from Walmart? Like, it serves the same purpose for all intensive purposes. Some people might argue that there's slight benefits of one over the other, but really it does the same thing
Yeah, like
clinically.
yeah,
Yeah.
I think the chemical composition of the medication, sorry, the composition of the medication itself is identical. So I think the pill may vary in different sizes. I think that's one thing I noticed. So for example, there was a blood pressure medication I was taking and they ran out of the brand name or whatever because I didn't even ask. They just gave me the brand name, whatever, and they're like, "Oh, we have the generic form," and the pill was like twice the size. I was like, "Oh my god, I'm gonna choke on these," but it's fine. Like it's no different. I mean,
You made it work. You made
I
it
yes,
down.
I
Yeah.
started taking it with yogurt. So yeah, like I mean, I think I think at the end of the day, if uh, you guys listening out there, if there's anything that you could take is learn more about your system, learn more about our system. Don't just take it at face value to be like universal healthcare is the devil. Any plan out there is going to need work and need to be tweaked. There's nothing that's going to be perfect. I could tell you that. Like, I mean, I wouldn't say our healthcare system is perfect. It's definitely not. But I think it's a lot better than some of the horrible things that I hear out there. Um, and I mean, again, like where my heart goes out is the disparities, right? When you're hearing the inequities in terms of health equity, in terms of what this person can and can't afford. I think healthcare should be something that is a human right. I don't think that it's something that people should have to worry about. I think the very least our governments can do, or that we could do for one another, is to make sure that we're taken care of.
Yeah, and I think it puts nurses in a really tough spot if you have a patient that needs care and you can't provide it because they aren't able to finance what they need.
Right.
So I really feel for anyone that is in that situation.
Yeah, so if you take one thing out of this, learn about what it sounds like here, and ask questions, and never settle for, this is just what I've always done, this is what I know, and this is I'm happy with the status quo. Always push the status quo. Always ask questions. I think asking why is so important, and I think especially when it comes to your care and other people's care and your loved ones care, you need to really have an understanding of what your two candidates' platforms and their plans are. Yeah. So, do you have anything else that you'd like to add, or?
No, I can't think of anything else. I think we covered all our bases. Thank you for listening to the Gritty Nurse podcast. If you're listening on Apple, Spotify, YouTube, or any other podcast platform, please subscribe, leave us a rating and review. You can also follow us on Instagram, Facebook, and Twitter.
And remember, we have a Patreon account, Gritty Nurse. Please contribute anything that you possibly can to continue to help us bring stories of empowerment and enlightenment to you guys. Thank you so much for listening.
Thank you. Take care.